Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can I take antibiotics while on Entyvio? The use of Entyvio, generic name, vedolizumab, is not recommended in patients with an active, severe infection until the infection is controlled. Your doctor may consider withholding your Entyvio treatment if you have an infection while on treatment with Entyvio. Do not stop taking Entyvio without speaking to your doctor. Your doctor will be able to best decide if you need to take an antibiotic or stop Entyvio treatment. What does Entyvio treat? Entyvio, vedolizumab, from Takeda Pharmaceuticals is approved to treat adult patients with moderate to severe ulcerative colitis or Crohn's disease. Entyvio is a biologic drug and classified as an integrin receptor antagonist. It blocks circulating inflammatory white blood cells in the gut to decrease inflammation. Entyvio works differently than some other biologics, as it targets the gut specifically instead of the entire body. How is Entyvio given? Entyvio is given as an intravenous infusion or as a subcutaneous, under the skin, injection. Entyvio is given by a healthcare provider as an intravenous infusion through a needle placed in a vein in your arm. Entyvio infusions take about 30 minutes each time. You will receive 4 infusions every 8 weeks at a clinic after your first 2 initial induction doses. It can also be given as a subcutaneous, under the skin, injection after your initial 2 induction doses. Your healthcare provider can teach you, or your caregiver, how to administer these injections so you can use Entyvio at home. Subcutaneous injections are given every 2 weeks. Will Entyvio cause an infection? Entyvio may increase your risk of getting a serious infection. Before receiving Entyvio and during treatment with Entyvio, tell your healthcare provider if you think you have an infection or have symptoms of an infection such as fever, chills, muscle aches, cough, shortness of breath, runny nose, sore throat, red or painful skin or sores on your body, tiredness, pain during urination. Also let them know if you have infections that keep coming back. The most commonly reported infections in clinical trials included the common cold or an upper respiratory tract infection. Table 1. Incidence of common infections with Entyvio IV Infection type. Entyvio, 1,434 patients. Inactive placebo, 297 patients, nasopharyngitis, common cold. 13%, 7%, upper respiratory tract infection. 7%, 6%, bronchitis. 4%, 3%, influenza. 4%, 2%, sinusitis. 3%, 1%, tell your doctor if you have a history of infections that keep coming back or severe infections. Your doctor may screen you for tuberculosis, TB, before starting treatment. Serious infections have also been reported in patients treated with Entyvio, including anal abscess, sepsis, some fatal, tuberculosis, salmonella sepsis, listeria meningitis, giardiasis and cytomegaloviral colitis. If you have a weakened immune system, you may be at greater risk for progressive multifocal leukoencephalopathy, PML, a rare, serious brain infection caused by a virus. PML can result in death or severe disability. This is unlikely with Entyvio, but a risk cannot be ruled out. There is no known treatment, prevention, or cure for PML. Tell your healthcare provider right away if you have any symptoms like confusion or problems thinking, loss of balance, change in the way you walk or talk, decreased strength or weakness on one side of the body, blurred vision, or loss of vision. Before you start treatment with Entyvio, you should be brought up to date with all your needed vaccines. Once you start treatment, you may only receive live vaccines if the benefit outweighs the risk. Ask your doctor about vaccines before you start Entyvio. Also, be sure to tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins and herbal or dietary supplements. Related questions: how much does Entyvio cost per month? Is Entyvio an immunosuppressant or a biologic? How long does it take Entyvio to start working? Can other drugs increase the risk of infection with Entyvio? Yes. Especially tell your healthcare provider if you take or have recently taken Tysabri, vedolizumab, or Tiruco, natalizumab SZTN, Tumor Necrosis Factor TNF, blocker medicines. These drugs may increase your risk of a serious brain infection called progressive multifocal leukoencephalopathy, PML. A medicine that weakens your immune system, immunosuppressant. A corticosteroid medicine, for example, prednisone or methylprednisolone. Bottom line. The use of Entyvio is not recommended in patients with an active, severe infection until the infection is controlled. Your doctor can assess your infection and determine if you need antibiotics and if you should stop treatment with Entyvio. Entyvio may increase your risk of getting a serious infection. Tell your doctor if you have signs or symptoms of an infection, such as a fever, chills, muscle aches, a cough, or other symptoms. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.